All right, if we're all caffeinated, let's practice saying hi and unmuting our phones just for our speakers for just a moment. So if you go to your lower left, click on that mute button that might have a red line through it, and wave and say good morning in unison, and then we'll go back to mute.
Good morning.
Good morning.
We're warming.
Good morning.
Jenny.
Hi, everyone. Okay, then we'll go back to mute just to keep the background noise down. So I think many of you already know us, the Nicoles. I'm Nicole Lezin, and
I'm Nicole Young. To make sure I unmuted myself.
Yes, good practice. So we at the Nicoles are co-facilitators of the collective of results and evidence-based investments, the core investments process, which is a local collective impact initiative trying to use a collective impact approach to achieve equitable health and well-being throughout the county for everyone, for all people across the lifespan. And many of you have been involved in prior core events, core conversations, core trainings, peer learning circles. And like all of you, we are trying to transition some of that to this online format. So we're convening various capacity building efforts and training efforts through what we're calling the Core Institute for Innovation and Impact, or the Core Institute. So some of you have already participated in those sessions. This coffee chat, which we're trying to do some version of weekly, is one of the ways we're doing that. And it's an opportunity both to do practical sorts of skills building, like the Zoom classes we've been doing, but also some more reflections on some of the information from things like this COVID-19 survey. So today, we're going to be hearing from 2 local funders who are representing a larger group of local and regional funders trying to meet the needs that have been posed by the COVID-19 pandemic, but also looking ahead to the recovery from this and what we can learn to strengthen our safety net and other local agencies and institutions going forward. So to get started, we'd like to ask everyone to introduce themselves in the chat box. So again, the chat function is a bubble on the bottom of your screen, a little speech bubble with 3 dots. If you click on that, you'll see a chat box opening to the right of your screen, and you can send a message to everyone, which is the easiest thing to do. Or if you're having any kind of technical issues or glitches, Nicole Young can be messaged privately and she will help you out. So your personal IT department for this convening. Great. I see lots of you, lots of familiar names and faces, and some new ones as well, which is a great mix. Thanks, everyone. So if you can see that it's scrolling as more names fill in. Welcome. So we've got a lot of names from across the county, different sectors, different agencies. Welcome. Terrific. Okay. Thanks for those will continue to scroll as we go along. So I wanted to go over what we're going to talk about today. But first, we're going to do a poll, which is one of the features that you can use in Zoom. And so Nicole Young is going to launch a poll that is relevant to the survey that we're going to be discussing today, which was about some of your biggest needs as local nonprofits and agencies. So you should see a poll on your screen, for those of you who are on laptops and on phones. And you are being asked to pick the 3 biggest obstacles that your organization is facing right now as a result of the COVID-19 pandemic. And you can pick up to 3. If you're not seeing the poll on your screen or having any other difficulty accessing that, just let Nicole Young know. But I can see that we're getting lots of answers, so I'm hoping this is working for most of you.
So we'll give it maybe 5 more seconds before I close the poll and share the results. 3, 2, 1. I'm going to close the poll. And here are the
Okay.
results.
Can everyone see the results? Nod or give us a thumbs up. All right, great. So it looks like the disrupted revenue streams has really popped out there, but everything has been an issue for at least some of you. Okay. I wanted to review again, especially for those of you who might have joined a few minutes late, that we're going to be using the chat function to field your questions, but you can also get our attention another way. If you open the participants box by clicking on participants at the bottom of your screen, that's the silhouettes of people's heads. On the participants box, you'll see a series of icons, including a blue hand that you can raise your hand. And that will help us see if we need to hear from you or pay particular attention to a comment, because the chats are moving pretty quickly. We're doing our best to monitor them, but that's also a way to tell us if you can't hear or if there's something else going on that we need to be paying attention to. Okay, so let's get right into it and hear from Keisha Browder and Kevin Heuer, who are going to be talking about the results of the survey that many of you responded to, and you'll hear more about the number of respondents and how that was fielded, but more importantly, the kinds of themes that emerge from that. And Kevin will also let you know about the group of funders, the local funders who have come together to both understand the needs and to return some feedback to you on an ongoing basis. So Kevin, you want to go ahead and share your screen and unmute yourself?
Great, thanks, Nicole.
Thank you.
Good morning, everybody. Hopefully you can hear me okay, and I'll share my screen in just a second. I'm the Director of Engagement and Impact here at the Community Foundation. I saw a lot of familiar names in that chat box, which is great, and a few new ones too. So I help oversee our grant making and community engagement work here. And I'm also recently newly a teacher of a third grader, first grader, and pre-K kids. So I know a lot of you are juggling those new roles too. And it's, yeah, just a new reality. And we have the utmost sympathy for what our nonprofit sector is dealing with right now. I can't really imagine a worse scenario than what's happening right now. So I'll talk a little bit about some of the information that we've gathered, but actually maybe before I do, I could just ask Keisha if she could sort of share kind of how this got started, needs together between the United Way and the Community Foundation. Do you want to talk about that, Keisha?
Sure. Good morning, everyone. Your shelter-in-place outfits are great. I'm the CEO of United Way of Santa Cruz County, and like Kevin said, I'm also a new teacher of a set of twins in second grade and a 3-year-old. Teachers, I tip my hat, and all of the child care providers, I love you. Love you, love you. And so when we got word that our school districts were closing and shelter-in-place order had been given for our county, I reached out to Susan True to say, what can we do together as a community? I knew that it wouldn't be beneficial to you as our nonprofits to have all of these fragmented, separate efforts going on, but how could we collectively hear your voices, know your needs, and how can we respond as a community? So Susan and I truly connected on that and said, let's reach out and convene the local funders in our region to see how we can cast a wider net to the immediate response, the immediate needs, while also keeping on the horizon the recovery efforts that will need to happen once we get into post-COVID-19. So that's really how we we started. And today we have 9 of the most impactful funders in our region at the table, where we're looking at your needs. And Community Foundation put together a survey. I don't know if the slide is up yet, but we, as a team, we created a survey that went out to over 1,000 nonprofits just here in Santa Cruz County to understand the impact on your services, to learn about those unanticipated costs and loss of revenue, to learn about the month of cash reserves that you had prior to this crisis, and to learn about your greatest needs and resources now. So as you can see on your screen, together, it's the Santa Cruz Community Foundation, the Arts Council, United Way, Pajaro Valley Community Health Trust, Monterey Peninsula Foundation, the Packard Foundation, Driscoll's, Kaiser Permanente, and the Central California Alliance for Health. So we meet, and we just want to get a better understanding of those needs so we can identify where we need to turn our resources. What can we do both with our funding arms? What can we do with our advocacy arms to speak on to support you, to speak on your behalf, to speak with you?
Great, and I'll mention that, you know, if anyone on the call has not had a chance to take that really short survey, there's a link here which we'll share out so that you can take that survey and add your organization's experience to that list of 120. And it's also free to update for folks that have done it. I know this crisis is evolving hour by hour, and so a few folks have taken advantage to send in 2, 3, sometimes more responses as circumstances change. So we appreciate that. We share that, and you know, as Keisha said, we are well connected. This group of 9 speaking weekly, if not more often, both about what we're seeing, how we might help, how we can leverage other folks that are not part of this group, whether that's business, philanthropies, you know, outside of this group. So we are a little ad hoc committee doing our best to stay on top of needs and connect to resources. So I'll share a little bit about you know, what we're seeing, and this is not anything you don't know. It's thorough, it's complex, it's multi-layered in terms of kind of the devastation being wrought on both the community and the nonprofit sector right now, hitting across really everything. We already heard about that, you know, damage to revenue streams, programs that can't happen because they're in person, or there's a safety concern now, workforce limitations and absences that were in that poll, and finances in general taking a hit. So, you know, there's, you know, when I read through this, there was just a takeaway for me that there were obviously organizations kind of living close to the edge financially prior to this crisis that are now, you know, basically trying to operate in survival mode and adapt really deeply to try and make it through this. There were healthy organizations financially that are now, you know, not healthy and really worried about revenue and costs. So the other thing that stood out was, you know, something that always happens in disaster, which is that those disparities get amplified and those inequities either get revealed or just get magnified. So I'll be interested to hear people, and feel free to chime in the chat box now, and I think we'll come back to it later. But, you know, places where, you know, there's a population group or a part of the county or another segment that is not getting service, not getting the benefits. We know that there's all sorts of talk and hopefully all sorts of public aid and government assistance coming for certain folks, but we know it's not going to cover everybody. It's going to leave folks out. So I'll be interested to hear folks' own experiences with that. And then the other thing is just, you know, between the glut of information, the speed of, you know, the news, and then these sort of cascading effects from both the shelter orders and the school closure orders, just really making for a chaotic environment in which to make decisions when a lot of nonprofits are used to, you know, high level discussions with their board, maybe monthly, maybe every other month. And now, you know, having to be in much more frequent contact and not be able to be physically together. So I'm going to lay out a couple of the BFOBs here, which are the blinding flashes of the obvious for folks that this is all things that we know already. But, you know, when we look at kind of this 1-2 punch on, you know, both the loss of revenue streams, and, you know, some of that is related to contract work that can't happen, maybe because it's related to schools. There is a lot more, you know, new costs than I really anticipated in terms of folks trying to get that safety gear, personal protection equipment, sanitation, hygiene, other things to keep both clients and frontline staff safe. And, you know, we know that there are folks that have already done some layoffs or are considering layoffs or furloughs and trying to figure out if they can take advantage of government aid programs to keep their you know, workforce intact and hope to get reimbursed, you know, for carrying workers through, despite not being able to have the revenue to cover them. You know, the scope here financially, it's just, who knows? I mean, tens of millions, hundreds of millions locally, we don't even know. It's immense, and every organization's feeling it. In terms of services, you know, you all know, but there are, you know, a ton of cancellations, and we're seeing that start to happen now into the summer months. You know, arts organizations are, you know, with summer programming are already looking hard at that or making the decision to cancel those things given the uncertainty. And, you know, it has been interesting to see as organizations try and, you know, rethink programs and get creative about how to get services to folks that are sheltered in place, or, you know, if their workforce is at home and trying to transition to that new mode of service. Mentioned this briefly, but, you know, when we kind of tallied the numbers on those 120 responses, we asked the question prior to the crisis, where was your organization in terms of amount of months of kind of cash on hand or cash reserves to make it if there was no new incoming revenue? And, you know, it varied a lot. The average was about 3 months. I think the median was a little bit less than that. And so that means, you know, we took that poll a couple of weeks ago already. So into June, you know, there's going to be some serious threats to folks having to close doors or kind of shut things down into kind of a hibernation mode to try and, you know, wait it out with a minimum of expenses and, you know, other more drastic steps. And we, you know, we hope that that starts to change as these loans and federal grant programs start to become available for nonprofits. You know, this remote working stuff is a challenge for everybody, and you know, people are finding ways to get it done. It's actually been kind of inspiring to see how well people have been able to, you know, learn new skills. So credit to, you know, the core team for helping us with that last week. And there's still, you know, there's still definitely a digital divide, both with nonprofits and with a lot of clients we serve. Definitely seeing that play out in education. A lot of you mentioned that. Good news is, well, you know, I think we're going to see some progress in terms of, you know, both educators, educational system, getting some help to make sure households get access to hotspots so their kids can participate in their online distance learning, and hopefully some other support for nonprofits that are also trying to figure out how to take those calls that they can't take because they're not in their office or connect with each other in ways that they're not able to right now. Coming back to this idea of, that kind of magnification of disparities. I mean, some of the things you told us about, I'm thinking about the, homeless seniors, and, the inability to access congregate meal feeding sites, homeless people in general, and the difficulty in maintaining kind of the, safe, sanitary, hygienic conditions to keep them and their families safe. Folks that are renters and maybe subletting from somebody not on a formal lease, not protected by eviction moratoriums, perhaps, all the folks left out of programs like food stamps or CalFresh because they don't qualify for one reason or another. Students in higher ed, like Cabrillo students who really relied on being on campus and having access to computers there to complete their work. Health, lots of things trying to move to telehealth, but knowing that doesn't capture everybody in their ability to kind of meet with their doctor or their care provider over the phone. And then, really sadly, just that the toll it's taking, seeing some spikes in domestic violence calls and really, real difficulty on that level. And also, sadly, some, homicides in the county that may have some connection to the stress and anxiety that we're all feeling right now. And then a lot of you interact with, low-wage workers and farm workers and, folks that really rely on their cellular plan to both communicate with people and access the internet, who may not be able to make that payment or, buy those more prepaid minutes because they have to put everything towards rent right now. So, on the nonprofit side, I'll mention a couple things here that you talked about, just those of you on the reimbursement model for, government contract services or other reimbursements, that lag time from when you provided the service to when you get paid, be it 2 months later, 3 months later, in some cases, that just being extra painful right now. And then that uncertainty for folks on your workforce that might be 100% grant funded or contract funded for a program that you can't do anymore, that you would love to, re-enlist that member of your team for a new purpose, but might have some difficulty or leeway, getting to that. And Keisha, I know you saw some things here and wanted to comment on this too, so I'll let you weigh in here.
Yeah, just with the inequities, disparities, and sorry, I've been privately chatting with Jane about this as well. Just seeing this, the disparities with our students who are experiencing homelessness. While the technology, efforts are being made, we're seeing where some students don't have the opportunity to learn in a space where they won't be distracted. And so how do we reach those students who aren't living in a shelter, but who could be in their cars? Students who, they're in high school, but now they are at home because their parents are essential workers and they aren't able to be participants in class because now they're being called to be the babysitters for their younger siblings. So just seeing these things and just in our hard to reach, as we're looking at the census, our hard to reach, our hard to count, our undocumented neighbors, and our level of trust with accessing resources. The inequities grow. I appreciate Carolyn Coleman reaching out and saying, well, I've got a group here, and how do I get that information? How do I communicate that information? How do we communicate to our families the rapid change? I was going to speak on the next slide on some of the ways that we're trying to address these efforts. So want you to know that that group of 9, we did look at those surveys, and after pulling out the themes that we saw, it put us into action. So one of the first things that we did as funders was to make sure that we went out to each of you as grantees to say, if you were awarded funding for a particular program, you have the option to move that funding into your general operating, to support your general operating expenses. That was one thing that we were able to look at and say, we have control over that. We can change that, and we did. This also gave us an opportunity to be advocates for you. So going to the county, and the county recognizes those contracts and the way that they were written. That was in a beautiful world, and that world has changed. And so the county departments are looking at contracts to see where shifts can be made, to see where there can be some flexibility in some of those contracts where you just simply can't meet someone face to face. Other things that we looked at was reaching out to a group called Cruz, and these are local IT professionals, other tech professionals, Cruz.io, Looker, others who've said, okay, technology, we're going to pass out these Chromebooks, we're moving into distance learning, and we recognize the disparities, we recognize the inequities. So this team's working together with our COE to make sure that we can broaden the Wi-Fi, that we can go to apartment buildings and make sure that those apartments have the Wi-Fi and the free services that our young people and adults need. Shout out to Digital Nest and Salud para la Gente, recognizing that if we're talking about coronavirus and what we need to do, we need to make sure that we're communicating in multiple languages. And so Digital Nest worked together to worked with Salud to create a video, multiple languages that are being spread throughout our community, making sure that all flyers and resources are out there. So really tipping my hat to our nonprofit world, to you for being creative, working together, doing what you know to do, and that's how to live united, no pun intended, but really working together to make sure that we can reach all of our community in the resources. The other thing that I want to make sure I mention to all of you is that through the CARES Act that our government recently passed, there is one particular program that I want to make sure all of you are aware of, and that is the Payroll Protection Program. We will send a one-pager with an overview for you to take a look at. Oh, great, it's up. Here we go. So basically, with the Payroll Protection Program, there will be $350 billion available for small businesses and nonprofits with 500 or fewer employees. This is to cover payroll, rent, utilities for 8 weeks. If you, you have the ability to apply for 2.5 times more of your average payroll, rent, and utilities. And if you are able to maintain staff, what this funding is here to do is to keep staff employed. If you, after those 8 weeks, can show where you have kept your staff on payroll, the loan will be forgiven. All will be forgiven except for the interest. So with this Paycheck Protection Program, there are several lenders here in our county who are ready to help you, help answer questions. I'm not trying to show one over the other, just letting you know. You have Santa Cruz County Bank, Wells Fargo, Bank of America, Comerica, US Bank, and there could be others. So please look into this program. I do know that the application, it's a one-page application, and the application will be made available April 3rd. So I know it's a quick turnaround, but if you look at the overview, connect with one of those local lenders, and learn more, I really hope that you all will take advantage of this opportunity. I'm trying to not worry about the questions. So anyway, I really want you to follow up with that. That money is going to go fast, if you can imagine, $350 billion, and it's for nonprofits and small businesses throughout the country. Yes, Doron, you are correct. You can fill out the application and get in the queue for some of your lenders. So again, I highly suggest you go back to your bankers who may be on your board and learn more.
Thanks, Keisha. We see some questions coming in and we'll be tracking those, but before we get into those, we have another poll for you just to take the pulse of how this presentation of some of the experiences that people are going through resonates with all of you. So just a gut check on how you're doing. Can you let us know your reaction to the survey themes? Are these feeling more extreme than what you and your organization are experiencing right now, or are they pretty representative or less extreme? Okay. So at least from what's coming in, and we'll give it a few more seconds. It looks like these are pretty representative. There are a few of you who are experiencing more extreme situations. And again, we recognize this is a rapidly evolving day-to-day, hour-to-hour type situation, but we're trying to figure out some specific ways that the funders can be helpful, and you've heard about some of those already. But we're eager to hear more.
I'm going to end the poll now.
Okay, Nicole's going to end the poll and show the results. So you can see that held up, that for most of you, this is what's been shared has been pretty representative. And so this would be a time, if you have some questions or reactions to what Keisha and Kevin presented, to start putting those into the chat. So a couple of things that have come up already. There was a request for more clarity about communicating with nonprofits, specifically on the flexibility that Keisha mentioned. So Keisha and Kevin, I don't know if there's specific plans for that, or if that's just something to put into the hopper for quick action. Or if there's a more specific question that came from Mariah.
I would just, a question for clarity on the communication to nonprofits about the flexibility of funding. Are you more clear? I do know that those of us who have grants, we're grant makers, we did go back to our grantees to communicate with them that they could use their funding in general ops. Does that answer your question?
I've heard from one, but not, I've heard from one only.
Oh, okay.
And in that collaborative that we're taking input from the survey, we have multiple grants with multiple of those exact funders.
Okay.
So I've been holding off on bugging them,
Okay.
but to know that that was a decision and not just one of the funders who I happen to speak with is really helpful.
Okay. So it sounds like Kevin and Keisha, maybe in your weekly calls, that's something that could be a request for specific clarity from funders to their own grantees across the board.
Okay. Will do. Thank you, Mariah.
Thanks for the question. So there's another question about, oh, they're coming in fast here. Keisha, do you have an update on the 211 role as a central information clearinghouse?
Yes. So We are, I mean, as you can imagine, the rapid changes. We do have a Google Doc going out to the agencies who are currently in our database to ask for those updated, information, everything from new office hours to how you're specifically responding to COVID-19. And as we're getting updates from those nonprofits, we're sending that to our 211 operator. Since the request, we're working on how to keep the online updated as well. Because as the system is set up today, if I were just to use CAB as an example, if I were to go in and change CAB's office hours, and then let's say October, we're out of the clear, if a representative from CAB doesn't go back into the system and update those changes, it'll look like their office hours are set, you know what I mean? Set to today's office hours. So we're working on how to update the website without disrupting what's in there. So we are working on that piece, but you can call 211 and the operators do have your most up-to-date information. And I encourage you all to continue as changes are being made with you. Please make those changes with Cassandra Flores, our county's 211 manager.
Okay, thanks, Keisha. And speaking of communication, I just wanted to put the word out that Crystal Caballero with the Health Services Agency and part of the public information team is also interested in some of your communication needs, the types of communications, any particular misinformation that you're aware of that needs to be corrected, and other concerns that are being raised through your community contacts and groups. So look out for a communication from that team asking you about those questions in the near future. So I was encouraged, Keisha, to hear about the work with Digital Nest and Salute, and I'm sure there are other things going on that can be shared so people don't have to reinvent some of those resources. But if you have particular communication needs, that might be a venue for raising those. Mm-hmm. We also have a question, does anybody know if a fiscally sponsored project can apply for a loan, or does the fiscal sponsor itself have to apply?
I don't have an answer on that. I would have to look that one up. Okay. Yeah, I haven't read anything about fiscal sponsor organizations on that yet.
So we'll put that on the research and get back to you note on that list. There's another question about an organization that's not a current grantee, but would be interested in connecting to other local funding sources.
Well, and a little bit of a general comment, this group of 9 funders is really closely connected right now, and we'll still be maintaining kind of our, individual strategies and grant making funds that we had, in place prior to the crisis. There is kind of some pooled philanthropy from a fund that we're hosting, and one that's also over the hill that might benefit Santa Cruz County to a small degree. But it's still sort of a case-by-case basis of reaching out to those funders. I will add a link with this. We offer a searchable grants database here in our building, which is closed to the public, but I just got permission to share that out with you all so that you can access that foundation directory from your home.
Great.
Which we can do for now. So I'll share that link.
That's great. Thanks, Kevin. Kevin, let's go back to you. I see you're getting some thumbs up from people. So could we go back to your slides for a moment? Because we've got some other discussion questions we wanted to pose in the time we have left.
Sure.
And people, keep your chat comments coming and your questions, and we'll field as many as we can. But again, if we don't get to your particular question today, we are going to monitor that chat and save it and try to get some answers back to everyone.
Okay. So I guess, one other question I'll just pose that I'd love to see people weigh in on is, funders are I think all funders are really struggling right now of trying to figure out what's the right balance between funding immediate needs in this emergency kind of response phase and the recovery phase. And the best practices from other foundations and funders that have gone through disaster philanthropy is oftentimes they can do the most good by still having funds available in that recovery phase. And we just don't know what that looks like given the nature of this crisis. So we are thinking about, as we think about recovery for this, interested to hear from you all. What does that mean? I mean, I like that phrase that I heard that, we could bounce back from this to get to the status quo, or we could bounce forward and aspire to something higher than the status quo we had. You all know California's got the highest poverty rate adjusted. We've got the highest housing costs locally, almost anywhere in the world, and huge inequities and disparities in our community. So would love to hear how folks see opportunity to maybe see our neighbors differently, find whether there's benefits to extend, or safety net services that can get strengthened, populations that can be made less vulnerable and more resilient as a result of this. And I think we all like that phrase, never let a crisis go to waste, and we're interested in seeing how your organization thinks about that. Obviously you've got tremendous amount of things on your plate, but I'm sure there's still some vision there of what might be different and what we could work towards right now, whether that's a policy item, a funding item, or programs and services for the folks that you serve. So interested in hearing that. While people do that, maybe I'll move ahead here and I just wanted to touch on this relief fund that we set up at the Community Foundation, I think on the day after that school closures were announced. So we are encouraging giving from anyone and everyone to this fund so that we can get more money out to nonprofits. We've done, all told, I think we've got about $700,000 out there already from this relief fund. And it's definitely being shaped and informed by that group of other funders that we mentioned previously. So the focus has been on, it's really kind of the Maslow's hierarchy of needs right now, food, shelter, access to care, getting connected to application support for, benefit programs, loans, other things like that. So we're doing what we always do here, which is trying to inspire philanthropy from our donor advisors who are really stepping up right now. Contributions keep coming in from a lot of those donor advisors, giving us money from their fund to award, kind of as we see fit. So there'll continue to be waves of funding around that as we respond to needs. Keisha and I and the rest of us talk every Monday about what we're seeing, and then try and respond with grants. So I'm expecting we'll do more grant making in the coming days and weeks. So we're working off of that survey that folks sent, and then having just a lot of conversations with folks and trying to assess need and then make grants from there. So we've got information on our website if you want to learn more about kind of the funding approach there. I encourage you to take a look at that.
Great. I think that's going to be helpful to some of the specific questions coming in about people who might be restricted from funding for basic needs, but seeing that very urgently. I'm also seeing some comments about looking ahead to the recovery phase, to the question that Kevin posed. So some comments about paying more attention to seeing this as an opportunity for climate change into the future, for looking at some of the ways that we can use movement and wellness kinds of things, bridging the digital divide, some of those kinds of comments. Let's see, we've got some reactions to the the magnifier language that Kevin posed, totally agree. This really is something that helps us see things more clearly. What are some ways that that you see examples of resilience and strength, as well as some of the divides and issues we've been talking about so far?
Well, I'll definitely let Keisha weigh in on this too. You know, there's so many, and some of them are small and informal, and some of them are, you know, bigger and kind of more structural. You know, there's these groups of you all providers on certain issues, whether that's, you know, the housing group, folks focused on food security that, you know, just got on the phone and started coordinating with each other to make sure needs were well known and coordination was in place so that people knew the right information. I think, you know, that's sort of a gift right now, is ready access to the right information you can act on. And so we've seen a lot of great examples of that, because the public obviously needs that more than ever. You know, we've seen business step up. Keisha mentioned that Cruz.io and Cruz One enterprise that's helping the distance learning work smoothly. You know, I'm thinking about the example in Watsonville of the, you know, the soap company, Smith & Vandiver, changing their operations to sanitizer, and, you know, walking the first boxes of sanitizer across the street to Jacob's Heart families to make sure that they could help protect themselves. You know, thinking about the Center for Farm Worker Families in Watsonville, and, you know, the work that they're doing to rally donations, find extra food and supplies to get, you know, masa and beans and everything else to folks that are out of work right now. So there's just a litany of great examples, and it's absolutely a get it done mentality. I mean, you know, think about talking to folks like Teen Kitchen Project, where volunteers can't help right now for safety reasons, but staff is all in, making deliveries, you know, getting hot meals to folks that are really, really vulnerable, you know, isolated seniors that may not get that meal otherwise. And then childcare has been such a big barrier for, you know, frontline workers. And there's some of these households where it's, you know, two parents are both essential workers, and only one can report for work because, you know, they've got kids at home. So, you know, the YMCA in Watsonville, Boys and Girls Club in Santa Cruz, the Y up in the Redwoods, in Ben Lomond now opening up childcare for that front line is also, you know, really rewarding. So, you know, people are stepping up all over this county, both on the donor side and the nonprofit side. And I'll stop there and let other people weigh in on that.
Okay, great. Thanks, Kevin. We're also seeing some resource sharing and ideas in the chat box. So, for example, Caitlin suggested that people might want to use graphic recorders to share information, and Mariah has some resources if people are interested in that. We've got lots of comments about just what opportunities there might be to change the way we engage with each other like this, and that could be something that is sustained in the future. Let's see, Carolyn, you've got a comment about trying to provide needs as well as emotional connection and healing, balancing that most urgent need for basic supplies and some ways to sustain hope moving forward. Thanks. Keep those comments coming in. We're just trying to read and respond as we get them. Yeah. Really appreciate all these examples and questions.
I want to, if I can add, also county parks are offering, thanks Mariah, county parks offering childcare support. We see this, we have a new nonprofit, the Nonprofit Connection of Santa Cruz County with Rose Bellicetti, stepping in to help in a major way to continue to help broaden that reach and that communication. So if you're not a part of that for communication, I strongly encourage you to connect with the Nonprofit Connection because they also disseminate information, the rapid changes. I think about Poly with 211, we've gone from 55 operators to over 200 operators. And now we've reached out into communities. So we've had staff from the public libraries who reached out and said, hey, we're at home, we want to help. And so we have about 10 community volunteers who are now 211 operators, and Polly donated headsets for us to use to take on calls, 4-hour shifts minimum. Can get you information on that. It's just, there's a lot. I think about Maria Elena who's reached out and said, hey, we need hygiene we need the sanitation, the disinfectant wipes, we need cleaning materials. A lot of us nonprofits who don't own our own building, we're leasing buildings, we don't have to order those things. And so just seeing how we all rallied around to make sure, you know, CAB could get those supplies, but how do we go to UCSC and ask for those gloves and supplies to help our community? So lots of creative ways that we are working differently. And I agree, let's use this opportunity to bounce forward and not use our past as the, you know, as the aspiration. We're getting to design the new way our nonprofits respond and work as a community. I saw Yoga for All movement about how to utilize the good work that Shani does there. How do we connect to the youth who don't have technology? And we're grappling with that. But we have seen others like Food What, Salud y Cariño, and others who are doing exercise and meditation and offering these things on social media platforms. I'm in conversation with a couple of school districts to see if we can test out an opportunity for some of these videos to link with the Google Classrooms or the platforms that our schools are going to use. Because as we're using Instagram and Facebook Live, it's great. I'm not sure how many second graders have an Instagram account. I know mine don't, but you know, again, how can we make sure that we're reaching out to other children and providing that space and some, you know, just that supportive space. So we are thinking outside of the box and testing some things out now that we know that school is closed for the remainder of this academic year. How do we connect all of these great things that are happening and get them in front of our children and families?
Okay, thanks, Keisha. So it's nice to end this conversation on this optimistic note of what we can do better than we've done in the past, and to find some silver linings while acknowledging how desperately challenging and devastating this all is for so many people that we work with. We are going to keep these weekly coffee chats going, so we hope that you'll continue to participate. As we mentioned, if you can't participate live, we're recording them, so they're going to be on a YouTube channel for you to review later or share with colleagues. Nicole Young asked if you could share information and URLs and connections that we will distribute after this meeting by emailing her. You would have her email from the registration for this. We've learned about some security glitches in Zoom, unfortunately, where people are exploiting the links function in the chat box. So that's why we haven't been posting links directly. But please do send any ideas that we can share with the larger group. Before we run out of time, I wanted to give a huge thank you to Kevin and Keisha, both for presenting today and for everything else they're doing with this larger group of funders. We know your days are very long, and we really appreciate your both trying to identify needs and also share those with the group. And it's just so reassuring to know that you're working on all of this behind the scenes with that larger group of funders. We are so fortunate in Santa Cruz County to have you and to have acted early on some of the social isolation, social distancing that's going to make a huge difference. Even as hard as this is, it could have been so much worse. So thanks to everyone for hanging in there. Our next coffee chat is on Friday the 10th, where we're going to explore some issues in the education and arts sectors with Jim Brown and Farah Saba. So please join us for that and stay tuned for other upcoming meetings. And thanks to everyone. Stay safe, wash those hands. and hang in
Hashtag
Okay.
social solidarity.
There we go. Social solidarity. I like it.
All right. Thanks, everyone.
Okay.
Thanks, everyone.
Thanks, everybody.
Thank you.
Joe.